Guys, I will be discussing breaking bad news, okay? Breaking bad news, before I start discussing breaking bad news, I will tell you some principles, okay? Breaking bad news is a station that is a must in the exam. Small branch, but must. You cannot have PLAB 2 station, PLAB 2 exam, you cannot have PLAB 2 exam without a breaking bad news station, all right? So, what is breaking bad news stations? It is a station that will be diagnosed. You will have diagnosis there. You will have diagnosis. You don't need to take history. You don't need to take differentials. So what is my job in this case? Your job in this case is how to deliver bad news. So what is my job? My job in a breaking bad news station. So BBN, breaking bad news. My job is not to diagnose, is not to reach anything, but how to what? Deliver. How to deliver bad news to a patient or a relative. Okay. Before I start discussing breaking bad news stations, I would like you to know what is my structure. What is the structure that I will follow in a breaking bad news station? Breaking bad news station will be 3 parts. How many parts? 3 parts. 1, 2, 3. So 3 parts. I will try to bring them together to form the structure for breaking bad news. What is the purpose of a breaking bad news station? It's not medicine. This is not medicine. No. This is communication. How I deliver bad news. How I tell bad news to a patient. Okay. So what is the structure? The structure is 3 parts. The first part is, I call it history part. History. Yes, history. What do you mean, Dr. Mo, by history? I will confirm the full name of the person whom I'm talking to. Maybe I'm delivering bad news to the patient himself. So then I will confirm identity, full name and date of birth. Or I'm gonna be talking to a wife to break bad news for her about husband death. In that case, I will confirm her full name and her husband the full name and date of birth. Okay. But what is my history here in breaking bad news station? The first part is history. What is the history, guys? The history will be number 1. So this is the first part of the structure, yeah? History. But what do you mean by history? Differentials? No, you have diagnosis there. The history will be number 1, assessing knowledge. Oh, what do you mean, Dr. Mo? Assessing knowledge. What do you mean that the first point in a breaking bad news station is history and the first point is assessing knowledge? Guys, assessing knowledge is how much do you know about your condition, or how much do you know about your husband, your partner, your brother, your mother's condition. No. Why would I assess knowledge, and what is the importance of assessing knowledge? You gonna break bad news to a patient or relative. If you will tell me about news of my father's death, yeah? If I am expecting it, what do you mean expecting it? If I know that my dad is gonna die soon, is it gonna be the same breaking bad news, delivering bad news to me if I'm waiting, I'm expecting my dad to be better or to be okay? Is it gonna be the same? No. So that's why assessing the knowledge, in brackets, how much do you know about your dad's or your mom's, or is to check, guys, is to check the mental readiness. Ready. Is he ready mentally or not? Is he expecting the bad news or not? Because if he's not expecting the bad news, it will be more difficult for me. Clear? Number two, asking the risk factor. Oh, risk factor? What do you mean risk factors? Only risk factors of the cause of the condition. I will explain now. Oh, risk factor of the cause of the condition. What do you mean, Dr. Mo, risk factors of the cause of the condition? For example, if I am approaching a station where I'm gonna deliver bad news, sudden death of a patient who had subarachnoid hemorrhage. If I'm gonna tell his wife, what will be the first question that will run through her mind and ask me? Why did he have this? So unless I ask the risk factor early, I'm not gonna be able to answer her question. Do you agree with me? Dr. Mo, so you mean to say that I need only to ask about the risk factors? Yes, because before I started telling you about Breaking Bad News, I said to you, in Breaking Bad News, is there a diagnosis there or not? There is. In every station Breaking Bad News, there is what? You know the diagnosis, so you don't need differentials. You only need the cause. The what? Risk factor means cause. What caused the problem? For example, if I have subarachnoid hemorrhage, I would only not need to ask you here about high blood pressure, polycystic kidney, sudden death in the family. So when she asks me why did he have this, I have an answer. The third point. Am I still in the first part of the structure? Yeah, I'm still in the history. The history is 1, 2, 3. The third point is asking about the support system. The what? Oh, Dr. Mo, you need to ask about support system in history, in this first structure, yeah? Before you deliver the news, yeah, I need to ask about the support system. Why, Dr. Mo? Because that will be the support for the patient or the relative. Because when I break the bad news, rather than being blind and saying, well, Mr. Andrew, would you like me to bring anyone to be here with us? It's better to say, would you like me to bring your wife, your kid, your brother? So it's better to ask about that support. Who's going to be supporting this patient during and after receiving the bad news? That's it. This is the first part of my Breaking Bad News structure. So again, if I am delivering bad news to a patient, first of all, what is the purpose of the Breaking Bad News station? Is it medicine, or are they checking the way you deliver news? The way you deliver. Please, it's not medicine. It is the way I will deliver the news. How many parts, my structure? 3 parts. What is the first part? History. What should I ask? How much history should I take? Number 1 is think about what I'm telling you. Think. I need to assess knowledge for the patient or the relative, the person I'm talking to. Oh, why do I need to assess knowledge? Why do I need to know how much this patient or this relative know about the condition? Dr. Mo, to see, to check, is he mentally ready to receive the bad news or not? Is he expecting it or not? Because if he's expecting it, the breaking bad news will be easier. But if he's not expecting something bad, it will be tough. Clear. What is number 2 in history taking? Dr. Mo, I need to ask about the cause, the reason why this problem happened. Why it happened? Because the relative or the patient will ask me, why did my dad have this? Why? What is the third point? Dr. Mo, I need to ask about the support system. Who's with you in the hospital here? Or who do you live with? Yeah? Who's with you at home? Is there anyone here with you in the hospital? Why do I need to ask about the support system? Why do I need to ask about people around this patient or this relative? Because they will be the one who are supporting this person, which I will need when I break the bad news. Okay. Dr. Mo, this is the first part of the structure. What is the second part? The second part of the structure is delivering the bad news. Oh, delivering the bad news. Yeah, this is the second part, is delivering the news. But here, when I'm here to deliver the news, make sure physically, facially, your face is showing that there is something bad coming, and your body language, your gesture, your shoulder, you're showing that you are sorry. Can I tell the patient I am sorry through my face and my body or not? For example, if I'm saying to the patient, if I'm sitting and like this, and I'm saying to him, well, from the information and everything here, well, I'm suspecting that your husband will die. Or I can say like this, well, I'm really sorry, and I can, you see my face, my hand, my shoulder, can you see that there's something bad coming? So it is physically. So please make sure when you are delivering the news, more important than talking, show that you are sorry, or show you are gonna be delivering something bad. Okay? So how do I deliver bad news? How do I deliver bad news? I will deliver bad news simply by giving warning shots. By giving what? Warning the patient. But by the way, one of the points of warning the patient is what? Is what? Body language. So body language is one of the ways of showing warning. So delivering the bad news, again, will have 3 points. What do you mean 3 points? How many points here? Here I will have 3 points. I will have 2 warning shots. 2 what?
1.
So 1, 2. I will have 2 warning shots. Warning shot number 1. Warning shot number 2. Okay, after the 2 warning shots, the third point is telling the news. Is what? Telling the news. What do you mean, Dr. Mo? What do you mean 2 warning shots and then delivering the news? 2 warning shots means that I will ask my patient 2 questions, or I will tell my patient 2 things through which I'm trying to warn him there is something bad coming. There is what? Bad coming. How? And by the way, I said, what is the best warning shot? Body language, facial, body. If you don't show me this, you're gonna fail the station. The body language is the best warning shot. Okay? So 2 warning shots, which is Alicia or Andrew, what are you expecting? What are you expecting? What do you mean, what are you expecting? What are you expecting that might be happening? That's the first warning shot. Or, what do you think that might be happening? Or, do you have any idea what might be happening? So how many phrases I said? Use any of them. So, what are you expecting might be happening? Or what do you think might be happening? Or, do you have any idea about what might be happening? So do you have any idea what might be happening? Well, do you have any idea what might be happening here? That's the first warning shot. Do you have any idea what might be happening? If you think about it, what is the reason for the question? Expectations. Is he expecting death, news, or is he not? Well, doctor, I don't know about, I think like maybe he's having some mild infection. Well, doctor, I think maybe my husband is dying. Is it the same? What is the difference between the first and the second? The first, she's not expecting anything, infection. The second, she's expecting death. So if she said, well, I'm expecting he's dying, doctor, do you want to give her a second warning shot? No need, because she's expecting it. Then, well, I'm afraid it is the case. Well, I'm afraid, I'm sorry. Yes, it is. You understand me, guys? Don't be scripted. So if I'm asking my patient the first warning shot, do you have any idea what might be happening? And my patient said to me, well, I think I'm having HIV. Do you need to give him a second warning shot before telling the news? Or do you need to tell the news right away? I'm really sorry. Yes, this is the case. I hope you're not lost. Because that can be tricky. If they said, well, doctor, yes, I'm expecting HIV. Why do you need another warning shot? You are giving warning shots to break it down. But he's expecting it. But if I ask my patient, do you have any idea what's happening here? No, doctor, I don't. So should I give a second warning shot? Yes, the second warning shot will be what is written in the question. What do you mean, doctor? Well, we have done whatever they've done to confirm. We have done a CT scan, we have done 2 biopsies, we have done blood tests. Dr. Mo, where should I get this we have done thing from? From the question. The question will be saying CT scan was done, showed hemorrhage. The question will be saying blood was done, showed HIV. The question. So the second warning shot, it will be what was done to diagnose. Well, we have done such and such investigations, and I'm afraid the result were not what we were hoping for. The result what? Were not what we were hoping for. Then boom, what is the third step? Tell the news. Well, you have this, or we have found this. Guys, any problem in delivering the bad news steps? So when I'm delivering bad news, how many warning shots do I need? 2. Then, what is the third point? Telling the news. What are the 2 warning shots? Do you have any idea what's happening here? The second warning shot? Well, we've done this and this and that, and it's showing, boom, this. Telling the news. But if the patient is expecting, if the patient, you say to him or to her, do you have any idea what's happening here? Well, doctor, I'm suspecting that maybe I have HIV. Do you want the second warning shot?
No.
Right away, go for telling the news because she made the job easy. Okay. First part in the structure. Second part in the structure. What is the third part? The third part is managing. Is what? Managing. What do you mean, Dr. Mo, management? Managing the situation. What do you mean, Dr. Mo? For example, the patient whose husband had subarachnoid hemorrhage and will die. Khalas, he's gonna die. So what is the management part here? Is talking about palliative? Yes. It's talking about what's gonna happen later. It's talking about what we're gonna do to him, is palliative care, making sure he's not in pain, keeping his dignity. Okay. For example, a patient, you are talking to a mother about her son who had an accident and he's gonna go for surgery. He's gonna go for what? Surgery. So what is the management part here? After delivering the accident and need for surgery, what is the management part?
Consent.
Is what? Is consent for surgery, is asking about the history for surgery, ample history. When did he last eat? Has he ever had anesthesia before? Am I making any sense? So the management part is depending on the station. Depending on the station. Don't worry, I will discuss every station, okay? I will discuss every station and I will tell you what is the management part. So don't worry, I will discuss every station and I will tell you what is the management part, okay? So the management is depending on every station. So when we discuss the stations, that's when you will know every station how to manage. So, to recap, what is breaking bad news station? What is the purpose of a breaking bad news? Because guys, sometimes we are confused about breaking bad news. Sometimes we think it's medicine. Sometimes when the station is breaking bad news, subarachnoid hemorrhage, we start asking about the headache, where is it, how is it, where exactly, the grade, severity. No, the guy's gonna die. Why do you need the question said CT scan is confirming subarachnoid hemorrhage and he's gonna be under palliative. Doctora, what's your name? Doctora Marwa, what is the point of asking about where was the headache, how was the headache, the severity of it's written in the question, brother. CT scan is done and showing. Why do we ask in details about P1 presenting complaint? Why do we take differential? To reach the diagnosis is there in the question. So every single breaking bad news station, you will know what is happening. When I read the scenarios, you will see what is happening. No, the purpose of the breaking bad news station is how to deliver the news. So our structure is 3 parts. The first part is history. How much history should I take?
Assessing knowledge.
Differentials history? No. The history is, number 1, assess knowledge. How much do you know about your mom's condition? How much do you know about what's happening? Why do I assess knowledge? To check the mental readiness. Is she ready to receive the news or not? What is the second part after checking the knowledge, assessing knowledge? The second is risk factors. In brackets, cause. In brackets ده cause of what happened. Why do I need to ask about the cause? Because she will ask me later, why did this happen? What is the third point in the history part? Support. Who's next to you? Who's with you at the moment? Why do I need to ask about support? Because I will use support later in breaking bad news. When I break the news, I will say, who's here in the hospital? No. When I ask about the support early, and who's with you in the hospital here? Well, my sister. So in the breaking the bad news, I will say to her, would you like me to bring your sister with us? Guys, are you following me? So always ask about the support, because anybody who's receiving bad news needs support. The second part is delivering the news itself. I said to you, the most important part in delivering the news away from the warning shots is what? Face, body, shoulder, hands. My whole body should show that I'm sorry. My whole body should show that I'm delivering something bad. Clear? Well, I'm really sorry to be the bearer of this news today. You understand? So delivering the news, how many warning shots do I need? 2. The first warning shot, as simple as ideas. What's running in your brain? Do you have an idea what's happening here? Well, doctor, I'm expecting that maybe I'm having HIV. Do you need the second warning shot? You don't. Right away, he's giving you. Well, right away, I'm sorry. I'm really sorry to be the bearer of this bad news. Yes, we have done such and such, and it is showing this. But if I do the first warning shot, do you have any idea what's happening here? No, I don't, doctor. Do you need the second warning shot?
Yes.
And the second warning shot is simply as simple as, what did you have in your question to diagnose such and such? Well, I'm sorry, you have done a CT scan on your husband's head or Mr. Ali's head that showed bleeding in the brain. Did you see how I said bleeding in the brain? How? I was hesitating a bit. Why? Something bad, huh? Something bad. So when I told the bad news, well, I'm sorry. We have done, guys, can you see my face?
Yes.
We have done a CT scan on his head, and I'm sorry to be the bearer of this bad news. It's showing some bleeding in the brain. Can you see my face? Can you see my attitude? And when I say telling the news, showing bleeding, or HIV or death, what should I do after telling the news?
Pause.
Nobody did pause in the mocks, in the weekend, in our mocks. Nobody give this time to the patient to absorb. Everybody tells the news and carry on. Please, after telling the news and before you manage, please give what? Some time. Give what? Some time for the patient to what? Absorb. For the patient or the relative to absorb, please. When you tell me cancer, stop. When you tell me HIV, stop. When you tell me he's gonna die, please stop. Do not carry on. I need some time to absorb. And after you tell me the bad news, okay? What is the third part? Is management. How would we go further? If it's HIV, how would we go further? If it's my husband is gonna die, how would we go further? If it's gonna be a palliative care kind of thing, please make sure you tell him or you tell her, well, we're gonna make sure that he will live in dignity, we're gonna keep this and that. So the management part is what's gonna happen further. Does that make sense? So you're not gonna understand this unless I start reading the question and I start applying from the question into the station. Do you understand? Okay, so let's read the first scenario. Let's read the first scenario and let's see how we will go ahead. Okay? You right? The first scenario, you are an FY2 doctor in the pediatric department. 8 years old, Anthony was brought by the ambulance after road traffic accident. Listen carefully. After what? CT scan showed extradural hematoma, bleeding. The seniors are getting ready to take him to theater. To take him where? To theater. They're gonna take him to surgery. Talk to his parents. Did you understand the question? So, is there a diagnosis there? Is there a bleeding there? Is the scan done? Is he going to theater? So everything is there. It is confirmed. It is diagnosed. He's going to theater. So I will follow my structure. The structure is 3 parts. What is the first part? Assessing history, which is assessing knowledge, risk factor, support. Apply. Well, but in this case, when I open the door, please, in this case, when I first open the cubicle, there is a mother and father who will be running toward me. Doctor, tell us what's happening, doctor. Please don't panic. Please don't. 99% of us will jump into talking. No. Can we please have a seat? Can you have a seat so we can move further? I am here and I will try to address you. So please, in this case, the mother and the father will be running toward you. Please, don't panic. Don't panic. Relax, and you must just offer them to sit, and then I'm here to address your concerns. But before we go further, can you please confirm your full name and confirm the child full name and his date of birth? So I'm sure I'm talking to the right person. Please guys. And when you simulate, when you train on these stations, try to do this to your colleague. Let him sit in the room. Let your colleague come in and you run to him. Doctor, tell me what's happening. Then you will get his reactions. Then you will see, is he ready to just like calm you down or not? Because 99% of us will panic. And they'll say, yeah, I'm here to tell you about your son. He's this, he's that. No. What is the first part in the consultation? Confirm identity. Anyway, that's not my topic today, but I'm giving you a warning shot about the problem in this station. The parent will be running to you. Relax. Can you please have a seat? May I know that may I know just what's your full name and the son full name and date of birth, to know that I'm sure I'm talking to the right person. Then confirm identity, and then when you start, you're gonna start your history with assessing knowledge. What do you mean assessing knowledge? How much she knows about what happened. Does she know that he had CT scan? Does she know he's going to theater? Does she know what? So before I go further, so I explain myself in a better way, may I ask, how much do you know about Adam's condition? Or how much do you know about Anthony's condition? Well, doctor, I know that he had an accident, we were out, and then he got hit by a car. I don't know anything else. So does she know about the CT scan? No. Does she know about the surgery?
No.
So is it important here to assess knowledge? She doesn't know anything. So you know she doesn't know anything. Well, the risk factor. What is the risk factor in this case? What is the cause? What happened? The surgery. The accident. What happened? Risk factor. What is the reason why him being here? Accident. So, can you please tell me, how did the accident happen? When did it happen? Were you there? Yes, doctor. What did you see? Was he bleeding anywhere on his face, from his face, nose, ears, mouth? Was he having any fits? Did he lose consciousness? Can you guys? Was he hit by a car, by a motorbike, by a truck? I mean, how? the mechanism of happening of the accident. What happened? How did the accident exactly happen? Which is that? What is the cause? So the cause, the risk factor. What is the third step? Support. So, who's with you here in the hospital? Is anyone here with you in the hospital? Well, doctor, my husband is outside. My mom is outside. My daughter is outside. You understand me? So, support system. I will tell you the importance of support system now. So now I know how much she knows. I know the cause, which is the accident. I took some questions about that, what happened, and support system I know. Now I will start delivering that bad news. So what is the first shot? Away from the 2 warning shots, what is the main thing here? Before I start, I need to, well, can you please tell me, what are you expecting? Can you please tell me what your expectations are? Or can you please tell me, do you have any idea what's happening here? Can you see my face? Shoulder? Can you see? Well, doctor, I don't really know. What is the second step? Well, we have done such and such. Is it in the question? They've done CT scan. It shows bleeding. So I will use it. Well, we have done a CT scan on Adam's brain, on Adam's head, and I'm afraid I'm not having good news for you, or I'm afraid the results were not what we were hoping for. Second warning shot. And well, the result of the CT scan shows that he's having some bleeding in the brain. And then stop, let her absorb, let her cry. When she cries, leave her to cry, give her some tissue, some water, give her space for about 5 seconds, 10 seconds. Please don't talk. Now, the management part. What is the management in this case?
Consent for search.
No. What is the management? Theater. He's going to theater. Do you agree? So here I will talk about the theater. Well, my colleagues are preparing him to take him to theater. Would that be okay with you? Would that be all right with you? Because we are trying to basically take these blood clots from his brain. So we are preparing him for surgery. So management is surgery. Would that be all right with you? Clear consent. Yes, doctor, do what's better for him, do what's good for him. So for that, can I ask you some questions about his health, which will be important for us before we take him to theater? Then you can ask about any allergy, any medical condition, or is he on any medication? Okay? Past surgery, last meal, has he had anesthesia before? Oh, really, Dr. Mo, you've asked 5-6 questions quick. It's called ample history. It's called what? Ample. Ample. A-M-P-L-E. Ample. A for allergy or anesthesia. So allergy to anything. Has he ever had anesthesia before? M for medical condition. Is he normally fit and well? Is he on any medications? P for past surgery. Has he ever had any surgery before? L for last time he eat. Last time he had a meal. Last meal. Last time he eat. Guys, are you following me? How does that sound with the station? But one thing is you following the structure, and another thing is you getting trained onto using the structure without thinking about it. Do you understand what I'm saying? It's not history, assist knowledge. How much you know about his condition? Then the risk factor. I can see that he had an accident. Can you please? No, it's not. It is flowing. And flowing and going like this only from practice. Then now I'm gonna break the bad news. First question, first warning. Do you have an idea what's happening? The second, no. It's you physically, your face, your shoulders. So this is the structure for breaking bad news. 3 parts. First station is finished. Clear, guys? The second station, and I will apply the structure again. The second station is the same as the first station, but not bleeding in the brain. It's pelvic fracture and bleeding. Same. Read the question. You are an FY2 doctor in the pediatric department. 8 years old, Anthony Joshua had car accident. Had what? Road traffic accident. The ambulance took him. CT scan was done. Showed bleeding in his pelvis and fracture in his pelvis. Talk to his parent, address their concern. Follow the structure. First thing, when you open the door, what will be the family doing? They will be running at you. Please get used to this. Expect it. Practice that way. When they run at you, doctor, tell us what's happening, doctor. Don't worry. I'm here to address all your concerns, but can we just have a seat? So we are able to talk in a better way, and I will tell you all what you want to know. Or I will make sure I address all your concerns. Then start by what? Before we go further, in order to understand things in a better way, how much do you know about Adam's or Anthony's condition? Well, doctor, I know nothing. All what I know that he had a car crash, he got hit by a car, and then we brought him to the hospital. So does she know anything about that he needs to go to theater? Does she know anything about CT scan? No. Well, don't worry, I'm here to address your concerns. I can see from my note that he met on a road traffic accident, a car crash. What is the cause? Car crash. Can you please tell me, when did it happen? How did it happen? Was it a big car or a small car? Were you there? Yes, doctor. Can you tell me, what did you see? You understand? Did he lose consciousness? Did he have any injuries? Yes, doctor, he had injury in his leg, for example. Did he have any bleeding from the nose, from the ears, from the mouth? Did he have any fits? That's the cause. What is the cause? Accident. Then the support system. Can you please tell me, is anyone here with you in the hospital? Who do you live with at home? To ask about the support system. Then when you go to the breaking bad news, again, face, body language, physically. Well, do you know what's happening here? Oh, well, do you have any idea what's happening here? Well, doctor, I don't know what's happening. When you ask about idea, please, you can bring that. Very important to bring the support system. Would you like me to bring your sister, your mother, your father, whoever he mentioned? Don't bring haphazard. Don't ask that. Bring the support that he mentioned. Would you like me to bring your husband from outside? Well, doctor, no, you can tell me. Well, the second warning shot, well, we have done a CT scan on his pelvis. I'm afraid the results were not what we were hoping for. Look, guys, I give you the structure. Well, we have done whichever scan, whichever investigation you mentioned, the thing that it was done to confirm. I'm afraid I don't have good news for you. Adam is having fracture in his pelvis and he's bleeding, and we need to take him to theater. Should you carry on? Stop. Stop. Let her absorb. Guys, nobody stopped yesterday. Everybody in the mock was continuing. The management. The management. What is the management in this case? Surgery. See, surgery. So, it is very important to take Adam to theater now. Would that be all right with you? Consent clear. Are you happy with that? Would that be okay with you? Yes, doctor. So, Is it okay if I have a chat about his health to make sure that things are okay? Yes. Ample history. Does he have any allergy to anything? Anesthesia. Has he ever had any form of anesthesia? Medical condition and medication. Is he normally fit and well? Does he have any medical conditions? Is there any medications? P, previous surgery. Has he ever had any previous surgery before? LE, last time he eat. So last meal. So when did he last eat? She will answer your questions. Then you can even ask about blood group. What's his blood group? What's his blood group? Because you're gonna need blood transfusion. So is it okay to go with the surgery? Yes, doctor. Well, I'm sorry again. I'm sorry again to be the bearer of this bad news. My name is Dr. Fath Al-Bab. At any time you have any questions running in your mind, I'm here to address all your concerns. Please don't hesitate. Always in the station. The mother will have questions, guys. The mother will have questions. What type of questions can the mother have? The mother will have questions like, doctor, is he gonna die? Is he gonna die? Do you know? Do you know? Is he gonna die or not? So always when the mother is asking a question that you don't know, you're not sure he's not gonna die or not, he's gonna go through surgery. Always play it safe. What do you mean by play it safe? Well, I'm really sorry about what you're feeling. I can see you are worried. Yeah? Most children do recover. Most children do recover. We have a good team that perform these surgeries often. So let's hope for that. Yes. Did you promise her he's not gonna die?
No.
Did you tell her he's gonna die?
No.
So this is the answer. Politically correct answer. I don't know. Doctor, is it serious? Well, I'm afraid it is quite serious. But I have a very good team who deal with this kind of surgeries all the time. So again, did I tell her it's serious? But doctor, is there any treatment for it? Well, yes, that's why we are trying to prepare him for surgery. Okay? However, do we know the outcome? We don't know the outcome yet. So let's wait and hope for the best. And we'll only know after the surgery. Did I promise her anything? No. Doctor, can I see him?
No.
Well, yes, you can have a quick look at him. However, we are trying to prepare him for that surgery. So it's better to see him after surgery. So, do you understand? Yes, you can have a quick look. You understand? Maybe it's the last time, guys, you'll see her son. No. Maybe it's the last time. Yes, you can have a quick look, but we are preparing him for surgery. So, you will see him after surgery. Okay, but yes, you can have a quick look. Okay? I mean, imagine if it's you and your son. He's going for surgery, life-threatening. Do you want to see him?
Yeah.
So, yes, you can have a quick look at him, but we're preparing him for surgery, so, yeah. Doctor, will he have any brain damage? Yes or no? We don't know. Guys, I said you be answer in a political way. Well, I'm sorry for what you're feeling. We cannot say much until after the surgery. Most children do recover well without any problems. However, there is a slight chance of having some complications. Did I promise her anything?
No.
Guys, please, this is the way you will answer. So, what is the difference between the first scenario and the second scenario? What is the difference between the scenario of the brain and the scenario of the child who had pelvic fracture? Blood transfusion. Blood transfusion, in the second case, he's had pelvic fracture, he's bleeding heavily, so blood transfusion will be needed. The first one is Small bleeding. There's a bleeding in the brain. Is it the same as pelvic fracture? So no, make sure you don't forget about blood transfusion. Is it okay? He's gonna need some blood group. Okay. I'm not gonna go into details of what if she refused.
Blood.
You will give the blood. Why? Because you will work for the child's best interest. Okay? I can refuse for my own. Do I have capacity?
Yes.
Yeah, I can refuse. But my son, child best interest. No, you will give the blood. Third station. You are an FY2 doctor in the medical department. Alex, 85 years old, presented with headache. With what? Headache. CT scan was done and showed bleeding in the brain. Severe, massive bleeding in the brain. He's unconscious. He's unconscious, but breathing on his own. Unconscious. Yeah? But breathing on his own. Neurosurgeon decided that no active intervention will be beneficial. No? Guys, why do I read the question slowly? Because every single line will be important. When they ask you, you will answer from this. So no active intervention will be beneficial. And they decided that they're gonna put him under palliative care. So is he gonna die? Yeah, palliative care means he's gonna die. Not now, he's gonna die. Palliative. Just make him comfortable. Is he gonna die? Yes. Do you know when?
No.
No. Okay. I'm just discussing things before I start the session so you know. So if she said to you, is he gonna die? Is he gonna die? Yes, but we don't know when, but I'm afraid, yes. Okay. What is the management in this case? Palliative. Palliative care. Is CT scan done?
Yes.
Is it showing the bleeding in the brain?
Yes.
So is there bleeding in the brain?
Yes.
Do you have diagnosis? Yes, I have diagnosis. Yes, there's bleeding in the brain. Yes, it's palliative. So this case is the most common case in Breaking Bad news station. Subarachnoid hemorrhage. Subarachnoid hemorrhage. So let's follow the structure that I have mentioned in the Breaking Bad news station. Follow from the question. Open the cubicle. The wife is there. Hi, I'm Dr. Fath Al-Bab, one of the general doctors here. Can you please confirm your full name? And can you please confirm your partner or your husband full name and date of birth? She will confirm. History. What is the first point in history? Assessing knowledge. Can you please tell me how much should you know about Mr. Ali's condition before we go further? So I'm in a better place to answer questions. She will tell you, doctor, he had headache. He described it as the worst ever headache in his life. And I rang the ambulance and they brought him to the hospital. Do you want to ask for differential? No. Why do we take differentials? To reach a diagnosis. Do you have diagnosis here?
Yes.
Yes. That's it. Go to it. I'm really sorry for what you're going through. And thank you very much for doing the right thing and ringing the ambulance. Praise here. Risk factors. What are the risk factors? Do you know that it's subarachnoid hemorrhage? You know or not? Confirmed or not? Yeah. CT scan done. So all what you need is that, which is the cause. What is the risk factors for subarachnoid hemorrhage? High blood pressure, smoking, kidney problem, family history. Of what? Of sudden death, blood thinner, bleeding disorder. How many questions? 6 or 7 questions. That's the only questions you will ask. Well, I'd like to ask you some questions that will make me in a better position to answer your concerns. I'm sign what? I'm signposting. Signposting? Yes, doctor. So, about Mr. Ali's lifestyle and medical and health issues. Does he have any medical condition? Yes, doctor, he's having high blood pressure that was not controlled on medication. Does he smoke by any chance? Yes, doctor, he smokes. Apart from this high blood pressure, any other problems like any kidney problems? No, doctor. Was he in any blood thinners or any bleeding disorder? No, doctor. What I'm asking about? History or risk factor?
Risk factor.
Differentials? Risk factors. Well, I'm sorry to ask this question, it may sound alarming. Any history of sudden death in his family? Why did I signpost? Otherwise, you're breaking bad news like this. Signpost for family history of sudden death, or should I just say any sudden death in the family? You understand me? So almost signpost. I'm sorry to ask this question, it may sound alarming. Is there anyone in the family who had sudden death? So, no doctor. Support. Risk factors finished? Support. Anybody with you here in the hospital at the moment? Who do you live with? Or anybody's here with you at the moment? If she said, my sister is outside. My sister is outside. Keep it to yourself. Then come to the delivering the bad news. Or you can even say it if you're gonna forget. Would you like me to bring her to be with us while we're talking as a form of
Support.
very important. If you have breaking bad news without support, you're not gonna pass. Then go to the breaking bad news. I said to you, in delivering bad news, you need how many warning shots?
2.
2 plus telling the news. But I said before these 2 warning shots, what is the strongest warning shot? Which is your body language. How many warning shots? 2. Do you have any idea what's happening here? So I can say, do you have any idea what's happening? But I can say, well, do you have any idea what's happening here? Any difference between the 2 phrases?
Yes.
What is the second phrase? What is the first phrase? The first phrase is like, I'm feeling sorry here. So the strongest thing of breaking bad news is that physical expressions, face, hand, shoulder. So, do you have any idea what's happening here? No, doctor, I don't. Would you like me to bring your sister to be with us at the moment? What is that?
Support.
Support. No, doctor, you can tell me. What is the second warning shot? The second warning shot in every station. I said use whichever investigation is given in the question. Well, we have done look at my face, guys. Well, we have done a CT scan on Mr. Ali's brain, and I'm afraid I don't have good news for you. Guys, do you see how I'm hesitating? What does the hesitating means? No, something bad coming. It's like, I don't want to tell, like, when we found that there is a massive bleeding in his brain, and then what?
Silence.
Silent pause for 10 seconds, 5, 6 seconds. Don't worry, you're not gonna be running out of time, but if you don't pause, you're gonna be deducted marks. Then you will start managing. In this case, the management in one word. What is the management? Palliative. Where did I get palliative from? Question. It isn't the question. It said he will be under palliative care. Well, would you like me to tell you how we're gonna go further? Yes, doctor. Well, guys, the best way of telling a palliative is explaining it before saying it. What do you mean, doctor? I'm not gonna say, well, we will put him under palliative care. I will say, well, we will make sure that Mr. Ali, his dignity is kept. We will make sure that he's pain-free. We will make sure that we support him psychologically. We'll make sure that him and his family are comfortable and he's pain-free. What is that? That's the definition of what we call palliative care. What's better? Saying it, these beautiful words and then palliative, or saying palliative first?
Explain.
Did you get what I'm saying? So it's better. What's more comfortable for the relative? Saying palliative, then, oh, what do you mean, doctor? No. Again, would you like me to tell you how we're gonna go further? Look at my face. Yes, doctor. Well, we'll make sure that Mr. Ali is pain-free. We'll make sure that he lives in dignity, him and his family. We'll make sure that he doesn't have any pain, and we'll make sure that we support him physically and psychologically. Him and the people around him. What shall we call it? Palliative care. So basically, don't bring the big word, give the explanation first, and then I hope you understand which one is better. I hope you feel it yourself as I feel it. I feel that, you know, it's more comforting the way of explaining first. Then she will ask you questions now, concerns. Doctor, I have 2 sons, I have 2 kids. One in Australia and one in America. Should I bring them? Should I bring them? Yes, you can bring them. You will need the support around you. Mr. Ali will need your support and will need, yeah, his kids' support, definitely. Guys, definitely, yeah? He's gonna die. The second question, Doctor, why did this happen? They are all concerns now, yeah? The session is finished. Why did that happen? Well, from what you've told me, that Mr. Ali was diagnosed with high blood pressure, and also he had kidney problem, which is a risk factor for this bleeding that happened in his brain. You understand me? Do I have answer for the risk for the why it happened? Why do I have answer?
Yes.
Because I've asked the risk factors. The third question, Doctor, can you keep him in the ICU? The question, what did the question say?
Breathing.
Breathing okay, but unconscious, the brain. The hard disk is damaged, but the keyboard is okay. You understand? So do you need, no. So you will say to her, sit down, you can adjust things if you want. Yeah, adjust. So you can say to her, well, Mr. Ali is breathing on his own. Mr. Ali is breathing on his own. Being in the ICU will not benefit anything for him because he's breathing on his own. Does that make sense? So, ICU is for patients who cannot breathe on their own. Okay? But obviously you can say there, I totally appreciate your concern. I can see you are a concerned wife, you know? Try to. What is palliative care, doctor? I told you, it's giving the social, the psychological, the spiritual support to the patient and his family, people around him. And always end the station by, I'm Dr. Faisal Bab. At any time, you have any questions running in your mind, at any time, you need to ask me anything, please don't hesitate to ask me, okay? Always end it. Always leave the door open, yeah? The third station. The third station is the aortofemoral bypass. After the session, the third station is the aortofemoral bypass. Just I'm recording and I don't want to have what happened, questions in the middle. So just like, let's record and then we'll talk, okay? The third station is, the fourth station is aortofemoral bypass. It is about a station. You are an FY2 doctor in the surgery department, okay? 70 years old Sarah had right-sided aortofemoral bypass. Right-sided what? Aortofemoral bypass due to blood clot. After the operation, she developed bleeding as a complication. She received 6 units of blood, but she is still bleeding. She's been taken to theater. They are trying to stop the bleeding, but she is bleeding heavily. The complications were explained to the patient and her relative. Do you understand the question? Okay. Is she gonna die or not?
Maybe.
We don't know. Can she die?
Yes.
Maybe she's not gonna die?
No.
We don't know. Is it serious?
Yes.
Yes, it is. It is serious. Has the complications been explained to the patient and relative? Yes. Is it a common complication? It is a common complication. Where is she now? theater. So why, Dr. No, do you say this point? Because if you don't understand the question, you're not going to be able to answer the questions in the station. So, you took him to the hospital. Hi, I'm Dr. Fatih Albab, one of the general doctors here. Can you please confirm your full name? My name is Andrew Thompson. Can you please confirm your wife's full name and her date of birth? Okay, let's start. What is the first part? History. How many points?
3.
Assess knowledge to check the mental readiness. Risk factors, support system. Before we go further, can you please tell me how much you know about, or you can even say, I'm here to talk about Mrs. Alicia's condition. Before we go further, can you please tell me how much do you know about her condition? Well, doctor, I know that she had blood clot and she went to surgery in order to bypass this clot and save her leg. Well, that's right. We did take her to theater in order to save her leg by doing what we call it bypass. Do you know anything about the bypass? No, doctor. All this in where? No, doctor, I don't know. In the cubicle, if you find the pen and paper, grab them and draw for him. Grab them and any pen? Any pen? Grab them and draw for him. Pen. Okay. Perfect. Grab them and draw for him. Say to him, we have a big vessel in our abdomen, which is called the aorta. This aorta gives blood vessel that goes to the legs. If there is any blockage anywhere, sometimes we try to bypass it. So draw the vessel, aorta. It has blood vessels going to the leg. If there is any blockage, you try to bypass it. That's it. You are explaining what now? The surgery, the clot that was there and the bypass. Okay. Has anybody explained to the complications about this surgery? No, doctor. One of the main complications is bleeding at any site where we made the bypass, because the aorta usually have high blood pressure. All right, now assessing knowledge. Is it clear? So assessing knowledge is how much do you know? He knows that she went for surgery. Explain to him how the surgery is done, and explain to him that one of the complications is bleeding because of the blood pressure. Now, what is the second part in history? Risk factor. What is the risk factors for bleeding in this case? Number one, it can be without risk factors. Just the surgery itself, I don't want. But what is after that? Bleeding? Bleeding? Disorder? Yes. Being on blood thinner? Yes. Any high blood pressure? Yes. Diabetes?
Yes.
So, it's okay if you have chat about her health in order to be able to explain things in a better way. Yes, doctor. Does she have any medical conditions at all? By that I mean blood pressure problem, diabetes? No, doctor. Any bleeding disorder? No. Is she on any medications like blood thinner? No. So I asked 4 questions which are risk. Don't ask haphazard. Don't take history. Don't take history about what happened in the leg. You have diagnosis there. Just risk factors. Support. Is anybody with you in the hospital at the moment? Who do you live with? Support. Then move to delivering the bad news. When you deliver the bad news, I said, physically, face, hand, they all show that you are sorry. They all should show that you are sorry. Well, do you have any idea what's happening here? No, I don't know. Well, would you like me to call your sister? What is the sister? What is the father? What is the? It's the support. No, doctor, you can tell me what happened. What is the second stable warning shot? Bring. What happened? The question. Bring. Look. Well, we have whatever. So bring the stem. Well, Mrs. Alicia or Mrs. whatever Thompson, she started bleeding heavily. We have transfused her 6 units of blood. She's still bleeding. And now she's in theater. And we are trying our best to stop that bleeding, but it's difficult. I'm sorry to tell you that she is, what is the news? She is in a serious condition. She is having a serious problem. Stop or carry on? Stop. So guys, did you see the breakdown?
Yes.
Do you see how do I use the question in the second warning shot? So the second warning shot, I use it of the question. Stop, pause. So what is the step 3? What is the management in this case? What is she? Theater. So what would you do about it? Well, I can see her a concerned hospital. At the moment, she's in theater. Our team is working hard to try to stop the bleeding. They are doing their best to stop the bleeding, but I'm afraid she's bleeding heavily. Doctor, questions. Why didn't you tell me that this is gonna happen? I brought her with a problem in her leg and now I'm risking her life. Valid concern or not? Well, I totally understand where you're coming from. When you brought her, she had a blood clot in her leg. We tried to save her leg. Yes, bleeding is a complication, but it doesn't usually happen. It's one of the complications, but it doesn't happen in all patients. Doctor, would you like me to bring, or should I ring her sons? She's got 2 sons. Should I bring them? Do they need to come or not? Is it serious? Yeah, they need to come. You can bring them. At the end of the day, she will need all your support around her. Station is finished. Next station. So guys, I think by so far, with every station, you know how much history. That's my main concern, how much history. Yeah? Next station is ductal carcinoma in situ. 58 years old female. She was called to the breast clinic surgery to receive her blood result. Her what? Blood result. And she already had breast screening, mammogram, and fine needle aspiration biopsy that shows ductal carcinoma in situ. So, do you have diagnosis here or not?
Yes.
Okay. Do you know what she has?
Yes.
Yes. Is she known to you? Have you seen her before? Follow up. She's been seen, guys. Follow up, guys. She's coming, please, for follow up. She had mammogram. She had fine needle aspiration. She had her blood result, and everything shows ductal carcinoma. Is she known to you? Is that her first visit? Is she diagnosed?
Yes.
Do you need differentials? Breaking bad news. You don't need differential, but you need to ask about the risk factors. So, what is my approach? Is how can I help you? Or I can see from my note that you are coming for the result.
I can see from
Result. So I can see from my note that you are coming today for your test result. Yes. Thanks for coming to see us today. Obviously, confirm the full name and date of birth, yeah? Before we go further, is it okay if we have a chat about your health? Yes, doctor. How much do you know about your condition? Well, doctor, she will tell you the story. So I'm trying to assess her or trying to assess her mental readiness. Does she know what to expect or not? Well, doctor, I came with breast problem, breast discharge, whatever problem she came with. And they have done some investigations, okay? Would you like me to go through the investigations? Or is it okay if I have time to chat? Doctor, you can have a chat, it's fine. What is the second thing? Risk factors. What do you mean risk factors? Do you want to take differential? Do you need differentials here? Do you need differentials here?
No.
Why do we take differential?
Already done.
It's already diagnosed. So I just need to ask about the risk of having breast cancer or of having a breast problem. What are the risk factors for breast problem? Guys, family history,
Smoking.
smoking,
Oral contraceptive use.
oral contraceptive, HRT, hormone replacement therapy, yes. Late menopause, early period. So loads of problems that can be a reason why a patient can have breast problem. So ask these questions. Is there any history of any? So this question will go under the risk factor. Do you want to take differentials? No. You know the case. But why do I need to ask about risk factors? Because later on she will tell me, why do they have it? So you will need to ask risk factors, period, late menopause or early menopause, when did the period start, and smoking, medication like COCP and HRT. So take the history. After you take the history, the risk factors, move to the support system. Is there anyone with you here in the clinic? Where my husband is outside. Would you like us to call him in? Then go to the breaking the bad news. Well, physically, your face should show that you are sorry. Well, do you have any idea what's happening here? But this one is not cancer. So it's not gonna be, this one is early stage and you can treat it. Ductal carcinoma in situ. It's not breast carcinoma, yeah? So you know where you stand, it's not, you know? Well, do you have an idea what's happening here? No, doctor. I'm afraid when we've done the investigations, when we've done the mammogram, when we've done the biopsy, we have found, look, what is the second warning shot? What is the second warning shot? The second warning shot is using whichever investigation is done. Yeah? So use whichever was done here, which is, we have done mammogram, we have done the biopsy, and it shows ductal carcinoma in situ. When you tell her this, the news, what will she say? Doctor, is it serious? Doctor, what is this? Your answer will be, it is an early form of breast cancer. However, this particular cancer carries good prognosis and it is non-invasive, which means it doesn't spread outside the milk duct. So far structure, knowledge, risk factor for breast cancer, support system. How many warning shots? 2. My first warning shot, do you have an idea? My second warning shot is using what's in the question. We have done such and such and such, and it shows, tell the news, such and such. Okay, in management, the first question she asked me is what? What is ductal carcinoma in situ? Or, doctor, am I gonna die? Or is it serious? What is ductal carcinoma in situ? It is what? An early form of breast cancer. But what? But this particular cancer carry good prognosis and it doesn't spread and it can be treated. Clear, guys? Okay, now the management. What is the management here? What will be the management here? Breast clinic. Breast clinic. She will be treated in the breast clinic, breast surgery, which she's in. Why? Because how did she have the 5-needle aspiration and the mammogram? Yeah, so you will be followed up with us. Okay? We will do surgery. We will take these cells. Okay? We will take these cells and you can even be given, but not sure, hormone therapy. So it is surgery plus or minus hormone. But did I confirm or no, I said, well, this is the management plan. Whenever we have such patient, well, mostly the management revolves around surgery, and sometimes we can give some medication like hormonal therapy. Doctor, surgery, are you gonna take all my breast or a piece of it? Lumpectomy. So, sometimes or mostly we take, sorry? Small lump of it, lumpectomy, which we call it lumpectomy. Clear, guys? So, this case is again following the same structure. Do you take any differentials in Breaking Bad News? No? No differentials? It's all risk factors. Next station. Next station. You are an FY2 doctor, 40 years old. Andrea, or Andrew, whatever male or female, has had 2 tests for HIV a week apart or sometime apart. They were not together at the same day. And both confirmed that the patient is having HIV. Talk to the patient, address his or her concern. Breaking Bad News? Yes, okay. Do you need history?
Yes, risk.
Risk factor.
Sexual risk.
What I mean, do you need differential?
No.
Just risk factor. HIV. What is the risk factor for HIV?
MSN,
So you will take sexual history. What else? IV drug abuse. What else?
blood transfusion.
Blood transfusion. So this is the history. But any differentials I need?
No.
No. Why don't I need differential? Is it confirmed? I take differential to diagnose. I have diagnosis. So I will follow the same step. I will follow the same structure. Is she known to me? Do I know the patient? Yes, follow up. When I say is she known to us, I don't mean I know her personally. I mean, is it follow up or new patient? Follow up. So I can see from my note, that's always your start, that you are coming here today for follow up of your blood or test result. Yes, doctor. Is it okay to have a chat before we explain the result? Yes, we can. Assess knowledge. May I ask how much should you know about what's happening? Well, doctor, I don't know. Just I came and I had such and such symptoms and I took some investigations. I don't really know. The patient doesn't know what's happening. Risk factors. So the fact that you assess the knowledge again, it is to check the mental readiness. Is the patient ready or not? Risk factors. I'm sorry, I'm going to ask some questions that will help me later on in answering your questions or your concerns. Yes, doctor. They may sound quite intrusive. Yes, and then I will start asking about the risk factor. Sexual history in details. We know sexual history in details. Are you sexually active? By that I mean, yeah, she has sex. Do you practice safe sex? By that I mean the use of condom. Do you have a stable partner? Do you have any other partners? Travel history, IV drug abuse, blood transfusion. Support system. The only case where you don't need support system is HIV. Unless you need your wife as support system. If you need your partner as support system, can you, would you like me to bring your partner? Would you like me to bring your partner to support you while I'm treating with HIV? So you don't need support system here, okay? Because a patient who's having HIV wouldn't need anybody to know, yeah? Delivering the bad news. What is the first step? Warning shot. Well, Mr. Andrew, do you have an idea what's happening here? Physically, I kept repeating the point in every station, even though I could just go 5 minutes each. But I keep repeating again and again in every, have you noticed? Don't forget. So, do you have any idea what's happening here? No, doctor. Well, I'm afraid. We have done investigations 2 weeks apart. What is the second warning shot? The second warning shot is bringing, look. Warning shot is, well, we have done. Always in Breaking Bad News, the second warning shot is what was done, because Breaking Bad News confirmed or not? Confirmed. Well, we have done investigations, STI screening and HIV screening 2 weeks apart, and I'm afraid I don't have good news for you. Well, doctor, what do you mean? Well, tell him the news, HIV positive, HIV positive. Then after that, you need to move to management. Managing this case is what? Is a medication that will be given to the patient, antiretroviral medication, tablet that he will take daily. He will take daily. Is advising the patient to practice safe sex. By that I mean condom. Is telling the partner, inform the partner, and if the patient said no or why, tell him the risk and benefit. Well, she is at risk or he is at risk, whatever, and I think they should know about it because they will need to come and get tested. Am I making any sense? Yes. If not, partner notification program. If not, you can tell them. You can give him some time, the patient, to think about it, but we should tell them. So guys, in HIV and gonorrhea and chlamydia, it's fine. If the patient doesn't want to tell, you ask why, and you offer partner notification program, and you talk about the risk of not telling them, but you cannot force. But HIV, they should know. Does that make sense? They should know. Okay. So, station is finished. So, antiretroviral medication, safe sex, partner notification program. Now, the patient main concern will be, doctor, will I die? Well, why you think so? Can you reassure him? Yes, I can, 100%. Well, nowadays, HIV is like any medical condition. It's like what? With some tablets that you will take daily, everything will be under control. It is like diabetes, it is like hypertension. You can take a tablet and everything will be controlled. And we will monitor your blood through blood investigations, and we'll make sure that the viral load is low. Guys, by reassuring the patient with what I said, is it wrong or right? Okay, I will ask you another question. Is it false reassurance?
No.
Guys, it's not false reassurance. By the way, some phrases that I put in plug, I go off BBC and of the television. I did not get off my own brain. This is one of them. And another one is the autism. Remember autism? When I said, accept the child the way he is. By the way, this is not my own phrase. It is autistic specialist. I heard it on a documentary. And this is the same. HIV, I heard it. I've watched it somewhere. That's how they said. They said, well, it's like any medical condition nowadays. Diabetes, in fact, you can take many tablets. That's how they said it. High blood pressure, sometimes you can take even more than that. This is one tablet you will take that will control viral load and you will lead a normal life. Clear? That's the management. Next station. So if the patient is refusing, what to do? Refusal approach. Why are you refusing? Address the concern, risks of not telling the partner. So, partner notification program. Okay. Next station is okay. Next station is post-operative stroke. Post-operative stroke. Post-operative stroke. You are an FY2 doctor, the surgical department, 90 years old, diagnosed with intracranial tumor. She was diagnosed, or she's diagnosed with tumor in her brain. Surgery was done. She had an operation. And after the operation, it was noted to have left-sided facial weakness, slurred speech. CT scan was done and showed ischemic stroke. Her son is concerned, talk to him. So I will repeat the question again. this station in brackets, post-operative stroke. The station is, you are an FY2 in the surgical department. 90 years old, was diagnosed with intracranial tumor. She had an operation a week ago, and now she developed facial weakness, arm weakness, slurred speech. CT scan was done and shows stroke, ischemic stroke. Okay, it's not ischemic stroke. Okay, not hemorrhagic, ischemic. Talk to her son. Okay, I will ask you a few questions. Is it diagnosed?
Yes.
Do you need differentials?
No.
Okay. It's post-operative. Did she go for surgery? Yes, for tumor. And this is post-operative what? Complication, which is stroke. Now, where is the breaking bad news here? Is the operation?
No.
Does he know about the operation?
Yes.
He knows. She won't. But the thing that you're gonna break bad news for is the stroke.
Stroke, yeah.
Why do you say this, Dr. Mo, before the station? To make you aware of what's happening. So when you know the state you start, you know. Because your main problem and my main problem with you guys, wallahi, is not understanding the question. It's the fact that you don't understand it. It's no, you don't understand the question. You read it, you panic, you stress at the door, and then you get in, you don't know what's happening, you don't know what are you breaking, which news, and you don't. That's why I try now to break the thing and tell you. And sometimes you go and when he tells you like she's having a weakness, and then you say we'll run some investigation, CT scan, it's done. So no investigation, nothing. But I will start by, hi, I'm Dr. Fath Al-Bab, I'm one of the general doctors here. Can you please confirm your full name? Full name. Can you please confirm your mom's full name and date of birth? Assess knowledge. Can you please, before I go ahead, tell me how much do you know about your mom's condition? He will tell you. Doctor, she came to the hospital. She had a tumor in her brain. She had surgery. They took the tumor out. So does he know about the stroke?
No.
That's it. How do I know? From assessing that knowledge. All right. Is it all right if I ask you some questions about your mom's condition and your mom's health in order to be able to answer your questions in a better way? I'm signposting to take some history. I'm signposting to take some
History.
But can you see number 2? I said, is it differential or is it risk factors? So guys, don't take differential. Why do I take differential? To reach my diagnosis. Is it diagnosed? It is diagnosed. So all my history will be, has she had any strokes or many strokes before? Is she on any blood thinner or has she had any bleeding disorder? Why blood thinner? Why? Ischemic stroke is a clot. Yeah? Ischemic stroke is? So has she had any blood clots before? That's the meaning of bleeding disorder. Okay? Does she have any medical condition like high blood pressure? Is it a reason why she can have a stroke? Yes. Then, finished, support system. Is anybody with you here in the hospital at the moment? Who does your mom live with? Or who do you live with? I need to get what? Support. Then, delivering the bad news. I said 2 warning shot, and the telling the news is the 3rd step. But I said, what is the strongest warning shot? Is the body language. I can tell you, well, do you have any idea what's happening? And I can tell you, do you have any idea what's happening? And I can tell you, well, do you have any idea what's happening here? Does that show you any?
Yeah, suspicious.
Please, I said 2 warning shot and telling the news, but something I did not write. I said the strongest warning shot is the body language, yeah? So, do you have any idea what's happening here? No, doctor, yeah? First warning. Would you like me to call your sister, your mother, your father, whatever? What I'm trying to bring? Support. No. Second warning shot. I said the second warning shot I will use from the question. from where? And I said the second warning shot will be always the investigation that confirmed the problem. So, well, we have done what? CT scan. Well, we have done a CT scan, an image of her brain. Has anybody told you about the result? No. Well, I'm afraid I don't have good result. I'm afraid the result were not what we were hoping for. Can you see my body? Can you see my face? Something serious coming. Well, we found that she developed a stroke, which basically caused her weakness. And then stop or carry on?
Stop.
Why stop after telling the stroke?
Absorb.
Let him absorb, let him, don't tell him, well, she had a stroke, like, we tell you how we manage it. Guys, stroke, stop. And I've listened to the mock, the phones, and it's like, nobody gives this pause after the breaking the bad news. Nobody. That's why I decided, I said, guys, if you wanna watch, I'm gonna do the new course, the online course. So if you wanna watch, you can watch, because nobody gave pauses, everybody was asking detailed history, everybody was asking irrelevant questions, nobody was to the point. Then tell the news, stroke, then wait. After that, doctor, so what's gonna happen then? What's gonna happen then? Okay, she's having weakness in her arms, slurred speech, she's had a stroke. Is it reversible? The stroke, not the TIA. Is it reversible? Can it leave permanent damage? It can. Well, I'm sorry to come across that way. We'll give her medications, and sometimes patient do recover fully. However, what did I say, doctor? Sometimes the patient do recover fully. Listen to what's coming now. However, as your mom had tumor in the brain, and as she's 90 years old, vulnerable with medical conditions, there is a chance that she might have this permanent damage. So, did I gather both sides or not?
Yeah.
So I said some patients recover fully. But and I started mentioning that comorbidities that she has, as she has tumor, as she's this age, she might have permanent damage. So always play it safe. And let's hope for the best. Doctor, he can ask you, doctor, why did she have the stroke? Well, I can see they are concerned some, but as you know, your mom went through a surgery, which was tumor in her brain, and it was an expected complication for these surgeries. Also the fact that she's 90 years old and she has such and such condition which I got from risk factor. So she was at high risk of developing stroke. But we are trying our best to manage it and make sure that she'll be better. So always play it safe. If the patient asks you, if the relative asks you, will she die, will he die? If it's not written clearly in the question,
so the complications.
will she have yes?
Complications, the stroke is for the surgery or for the risk factors?
The stroke happened, we don't know the cause. But there are risk factors. Could it be the surgery?
Yes.
She had, guys, tumor in the brain. Could it be complication?
Yeah.
Could it be the comorbidity?
Yeah.
Could it be the age?
Yeah.
Someone had brain tumor and then she developed the stroke. Expected. But you're not going to say expected, obviously. You're going to make him expected. No, you're going to say, well, it could be the surgery itself, could be the fact that, your mom, she's have comorbidity and this and that. But, doctor, will she recover fully or not? Do you know? We don't know. Well, some patients do recover. However, in this case, let's hope for the best. We will do our best. We'll make sure that she's managed the correct way, but there's a chance of her having this disability, you understand? Chance of her, having this permanent damage. Okay? There is a station that is similar station. Yeah? A patient who had stroke 90 years old, Andrew, presented to the hospital with a stroke. He was managed and he developed another stroke. Talk to his daughter, would you change anything? However, the only thing in this case that his daughter is pregnant. What is the meaning of pregnant?
She wants to see.
Vulnerable. Would you talk to a pregnant woman like a normal woman?
No.
Would you talk to a pregnant lady like how you talk to a lady that she's not vulnerable? Someone who's pregnant. A lady who is pregnant, would you deal with her as a lady who's not pregnant?
No.
She's vulnerable. So in this case, you just need to be so softer and slower. And that's it. She will tell you, doctor, I need, my dad to see my his first grandkid. Please, can you promise her anything?
No.
Guys, please, can you say, well, we'll try our best for him, It is written that it's a serious, life-threatening, and can you promise anything? So you will go with the same structure, assess knowledge, how much she knows, risk factors of stroke, high blood pressure, smoking, previous strokes, previous DIA, family history, bleeding disorder, blood thinner, support system. Go with the warning signs. The first warning we know, do you have an idea? The second warning is the scan, then tell the news, and then in the management, she will keep telling you, please, can you extend his life expectancy? I want him to see his grandkids. Well, I can see our concerned daughter, but it's not really up to us. We try our best, this and that, you cannot promise, okay? Thank you very much. Can you switch over?